If you reach for the same pill every time your knees ache, if you rely on a common medication to get through your day without joint pain, or if you have been told to just keep taking something for your arthritis because that is all you can do, I need you to stop and listen carefully to what I am about to share, because the very thing you believe is helping you may actually be destroying your joints faster. This is not about living with pain. This is not about accepting that arthritis means suffering for the rest of your life. This is about understanding that one of the most commonly recommended solutions for arthritis pain has a dark side that most people never hear about. What I am going to reveal may contradict what you have been told for years. It may challenge advice you received from well-meaning doctors. But the research is clear, and you deserve to know the truth before more damage is done. Let me make you a promise right now. By the end of this video, you will understand exactly which common medication accelerates joint destruction, even while providing temporary pain relief. You will learn the mechanism behind this damage and why it happens so quietly that most people never connect the dots. And you will discover what actually supports joint health instead of undermining it. This information could change the trajectory of your arthritis. I am Dr. James Mitchell. I have spent over 25 years working with patients suffering from arthritis and joint pain. And one of the most frustrating patterns I see is people who diligently follow conventional advice, take their medications as prescribed, and watch their joints get progressively worse year after year. They are told this is just how arthritis works. They are told it is degenerative and inevitable. They are told to manage the pain and accept the decline. But what they are rarely told is that the medication they rely on for daily relief may be accelerating that very decline. The tragedy is that many of these patients could have slowed or even halted their joint deterioration if they had known the truth earlier. Instead, they spent years unknowingly making their condition worse. So let me ask you directly. Are you currently taking over-the-counter pain medication for your arthritis regularly? Have you noticed that you need more medication now than you did a few years ago to get the same relief? Write your answer in the comments below, because understanding this pattern is essential, and the sooner you recognize it, the sooner you can make different choices. Let me tell you about a woman named Barbara. Barbara was 67 years old when I first met her. She had been dealing with knee arthritis for about 8 years. When it started, she would take ibuprofen occasionally when the pain flared up. Over time, occasionally became daily. Daily became multiple times daily. Barbara did exactly what she thought was right. When her knees hurt, she took the medication that made the pain stop. She figured if the pain was controlled, the problem was controlled. That seemed logical. But every year her x-rays showed more deterioration. The cartilage in her knees was disappearing faster than her doctors expected. They told her arthritis was just progressing normally. They told her she would probably need knee replacement surgery within a few years. When Barbara came to see me, she was taking 6 to 8 ibuprofen tablets every single day just to function. She could not imagine life without them. But she also could not understand why her joints kept getting worse despite religiously managing her pain. What Barbara did not know was that the very medication keeping her comfortable was actively breaking down her cartilage. The ibuprofen was not just masking pain. It was accelerating the destruction of her joints. When we changed Barbara's approach, when we stopped the constant ibuprofen use and implemented strategies that actually supported her joints, something remarkable happened. Her pain did not disappear overnight, but over months it became more manageable, and her joint deterioration slowed dramatically. Her last x-ray showed almost no change from the previous year, the first time that had happened in a decade. Barbara's story is not unique. I see this pattern constantly, and it points to a critical truth about arthritis that most people never learn. Here is what I need you to understand. The medication I am talking about is not some rare prescription drug. It is not something only specialists prescribe. It is the most commonly used class of medications for arthritis pain in the world. I am talking about NSAIDs, non-steroidal anti-inflammatory drugs. This includes ibuprofen, which you know as Advil or Motrin. It includes naproxen, which you know as Aleve. It includes aspirin when used for pain relief. And it includes prescription versions like celecoxib, diclofenac, and many others. These medications are in virtually every medicine cabinet. They are available without prescription. They are recommended by doctors and pharmacists constantly. And for acute pain from injuries or temporary inflammation, they can be appropriate when used briefly. But for chronic arthritis pain, the research now tells a very different story. Studies published in major medical journals have found that regular NSAID use actually accelerates cartilage breakdown in arthritic joints. The medications provide short-term pain relief while causing long-term structural damage. You feel better today while your joints get worse over time. This is not a minor effect. Research shows that people who regularly use NSAIDs for arthritis have faster joint deterioration than those who do not use them. Some studies suggest the rate of cartilage loss can be significantly higher in regular NSAID users. Let me explain why this happens, because understanding the mechanism helps you see why this is not just bad luck but predictable biology. When you have arthritis, your joints are inflamed. That inflammation causes pain, stiffness, and swelling. NSAIDs work by blocking enzymes called cyclooxygenase, or COX enzymes that produce inflammatory chemicals called prostaglandins. By blocking prostaglandin production, NSAIDs reduce inflammation and pain. That sounds exactly like what you want, and in the short term it is. But here is the problem. Not all prostaglandins are bad. Some prostaglandins are actually essential for cartilage repair and maintenance. They stimulate the production of proteoglycans, which are crucial components of healthy cartilage. They promote the synthesis of collagen, which gives cartilage its structure. They help regulate the balance between cartilage breakdown and cartilage rebuilding. When you take NSAIDs, you do not just block the bad prostaglandins causing pain. You block the good ones too. You shut down the very processes your cartilage needs to repair and maintain itself. Additionally, NSAIDs have been shown to directly inhibit chondrocytes, which are the cells that produce cartilage. These cells are already struggling in arthritic joints. NSAIDs make them struggle even more. There is another mechanism at work as well. When you block pain, you can actually overuse your damaged joints without realizing it. Pain is your body's warning signal. It tells you to rest, to protect, to modify your activity. When you silence that signal with medication, you may push your joints beyond what they can handle, causing more mechanical damage. So the person taking NSAIDs daily feels good enough to keep doing activities that are actually grinding down their cartilage. Meanwhile, the medication is also inhibiting the repair processes that might otherwise help. It is a double assault on already damaged joints. Let me tell you about another patient named Richard. Richard was 73 years old and had been taking prescription-strength NSAIDs for his hip arthritis for over 12 years. His doctor monitored his stomach and kidney function as recommended with long-term NSAID use. But no one ever told Richard that the medication might be harming his hip. Richard came to me after being told he needed a hip replacement. His hip had deteriorated to bone on bone. He was in constant pain even with maximum medication doses. He felt like his body had failed him. When I reviewed Richard's history, the pattern was clear. His hip had deteriorated steadily during the 12 years of daily NSAID use. He had started with moderate arthritis. He was now at end-stage disease. Richard asked me directly if the medication could have contributed to how bad his hip had become. I had to tell him that research suggested it was possible. The correlation between his medication use and his joint deterioration was exactly what studies predicted. Richard wished he had known earlier. He said he would have tried anything else if he had understood the trade-off he was making. Now I want to be very clear about something important. I am not telling you to stop taking medication prescribed by your doctor without consulting them first. NSAIDs can be necessary for some situations. They may be the best option for certain acute conditions, and stopping medication suddenly can sometimes cause problems. What I am telling you is that the information about long-term NSAID effects on cartilage is something you deserve to know. You deserve to have a conversation with your healthcare provider about these risks. You deserve to explore alternatives that may provide relief without accelerating joint destruction. Here is another critical piece of information. The relationship between pain relief and joint protection is not what most people assume. We tend to think that if pain is controlled, the problem is controlled. But with arthritis, this is often exactly wrong. Medications that provide the best short-term pain relief are often the worst for long-term joint health. And approaches that actually protect and support joints often provide more modest pain relief initially. This creates a trap. People naturally gravitate toward what makes them feel better immediately. The medication that provides dramatic quick relief wins. But that quick relief may be purchased at the cost of faster joint deterioration. Meanwhile, strategies that actually support joint health, things like specific nutrients, gentle exercise, weight management, and anti-inflammatory foods, often take weeks or months to show significant benefit. They require patience. And because the benefits are gradual, people often abandon them before giving them a chance to work. So the very nature of how we evaluate treatments pushes people toward options that feel good immediately, but harm them long-term. Now let me share what actually helps arthritic joints rather than harming them. The first and most important principle is reducing inflammation through methods that do not shut down prostaglandin production entirely. This means addressing inflammation at its source rather than just blocking its symptoms. Diet plays a massive role in systemic inflammation. Processed foods, refined sugars, industrial seed oils, and excessive omega-6 fatty acids all promote inflammation throughout the body, including in your joints. Meanwhile, omega-3 fatty acids, found abundantly in fatty fish like salmon and sardines, have powerful anti-inflammatory effects that support rather than harm joint tissue. People who shift from a typical inflammatory diet to one rich in omega-3s, vegetables, and anti-inflammatory spices often experience significant reduction in joint pain over weeks to months. This reduction comes without the cartilage-damaging effects of NSAIDs. I had a patient named Dorothy who was skeptical about dietary changes helping her arthritis. She had lived with the condition for years and taken NSAIDs the entire time, but she was worried about the effects on her stomach and kidneys and wanted to try something different. Dorothy eliminated processed foods, added fatty fish several times per week, began using turmeric and ginger regularly, and dramatically reduced her sugar intake. For the first 2 weeks, she noticed nothing. She almost gave up. But by week 4, her pain began to decrease. By week 8, she was using NSAIDs only occasionally instead of daily. By 6 months, she rarely needed them at all. Her mobility improved, her morning stiffness decreased, and she was not damaging her cartilage in the process. Dorothy's experience is not unusual. I have seen it repeated many times. The body has remarkable capacity to reduce inflammation when we stop fueling the fire. The second principle is providing joints with the raw materials they need for repair and maintenance. Cartilage is made of specific compounds including collagen, glucosamine, chondroitin, and hyaluronic acid. As we age, our production of these compounds decreases. Providing them through diet or supplementation can support joint structure. Glucosamine and chondroitin supplements have been studied extensively. Results are mixed, but many patients report significant benefit, particularly when these supplements are taken consistently over months. Unlike NSAIDs, they do not appear to harm cartilage and may actually support its maintenance. Collagen supplements have gained attention in recent years. Type 2 collagen specifically supports joint cartilage. Studies show that hydrolyzed collagen can reduce joint pain and may support cartilage integrity over time. Bone broth is a traditional food that provides collagen and other joint-supporting compounds naturally. The third principle is appropriate movement. This seems contradictory to many people. They think if joints hurt, they should rest them completely. But research shows that gentle, regular movement is essential for joint health. Cartilage does not have its own blood supply. It receives nutrients through a process that requires compression and decompression. When you move your joints, you literally pump nutrients into the cartilage and waste products out. Joints that do not move become starved and deteriorate faster. The key word is gentle. High-impact activities that pound on arthritic joints cause damage. But low-impact movement like walking, swimming, cycling, and specific exercises that maintain range of motion actually support joint health. Many patients find that their arthritis improves significantly when they begin appropriate exercise programs. The pain may initially increase slightly, but then decreases as joints become stronger and better nourished. Let me tell you about a man named George. George was 69 years old and had stopped almost all physical activity because of his knee arthritis. He would sit most of the day to avoid pain. His mobility had decreased dramatically. His knees felt stiffer and stiffer. George assumed that rest was protecting his joints. In fact, the opposite was happening. Without regular movement, his cartilage was starving. His muscles were weakening, which put more stress on his joints. His range of motion was shrinking daily. We started George on a gentle aquatic exercise program. The water supported his weight while allowing him to move freely. It was difficult at first, but within weeks, George noticed his knees felt looser. Within months, his pain had actually decreased. His need for pain medication dropped substantially. George's cartilage was finally receiving the nutrients it needed. His muscles were providing better support for his joints, and he was not taking medications that were accelerating his deterioration. The fourth principle is reducing mechanical stress on joints through weight management and appropriate support. Every excess pound you carry multiplies the force on your weight-bearing joints. Studies suggest that each pound of body weight translates to about 4 pounds of force on the knees during walking. Losing even modest amounts of weight can significantly reduce joint stress. Proper footwear, supportive braces when appropriate, and correct body mechanics all help reduce the wear and tear on arthritic joints. These interventions do not mask pain. They actually reduce the mechanical damage that causes pain in the first place. The fifth principle is targeted natural anti-inflammatories that work differently than NSAIDs. Turmeric and its active compound curcumin have been shown in multiple studies to reduce joint pain and inflammation. Unlike NSAIDs, curcumin appears to selectively modulate inflammatory pathways without completely shutting down prostaglandin production. Some studies suggest it may actually be protective of cartilage. Ginger has similar anti-inflammatory properties and has been used traditionally for joint pain for centuries. Boswellia is another herb with demonstrated effects on joint inflammation. Omega-3 fatty acids, as I mentioned earlier, provide potent anti-inflammatory benefits. These natural approaches typically provide more modest immediate pain relief compared to NSAIDs, but they do not carry the cartilage-damaging effects and may actually support joint health over time. Now I want to address the emotional side of this information because I know it can be difficult to hear. If you have been taking NSAIDs for years for your arthritis, you may be feeling upset or even angry right now. You may be wondering why no one told you this sooner. You may be worried about damage that has already occurred. I understand those feelings. The healthcare system often focuses on symptom management rather than addressing root causes and long-term consequences. Information about NSAID effects on cartilage has been in the medical literature for years, but has not widely reached the public. Please do not waste energy on blame or regret. What matters now is what you do going forward. Joints do have some capacity to stabilize and even improve when we remove the factors accelerating their decline. The cartilage that remains can be protected. Further deterioration can often be slowed or halted. I have seen patients who were headed for joint replacement surgery avoid it entirely by changing their approach. I have seen patients who expected to be in wheelchairs maintain their mobility for years longer than predicted. Change is possible. Here is what I recommend as a starting point. First, have an honest conversation with your doctor about your NSAID use. Share that you have learned about the potential effects on cartilage and you would like to explore alternatives. Ask about the possibility of gradually reducing your reliance on these medications while implementing other strategies. Second, begin making dietary changes to reduce systemic inflammation. Eliminate or dramatically reduce processed foods, sugar, and refined carbohydrates. Increase your intake of fatty fish, vegetables, and anti-inflammatory spices like turmeric and ginger. Consider an omega-3 supplement if you do not eat fish regularly. Third, consider adding joint-supporting supplements after discussing with your healthcare provider. Glucosamine and chondroitin are reasonable options for many people. Collagen supplements may provide benefit as well. Fourth, begin a gentle movement program appropriate for your current condition. If you have access to a pool, aquatic exercise is ideal for arthritic joints. Walking is beneficial for most people. The key is consistent, gentle movement rather than aggressive exercise that stresses damaged joints. Fifth, if you are carrying excess weight, make this a priority. Even modest weight loss can substantially reduce stress on weight-bearing joints. Sixth, explore natural anti-inflammatories as alternatives or additions to your current approach. Curcumin supplements, ginger, and other natural options may allow you to reduce NSAID use while maintaining reasonable pain control. Let me share one final story. A man named Walter was 77 years old and had severe arthritis in both knees. He had been taking prescription NSAIDs for over 15 years. His doctor had recently told him he was running out of options. His joints were severely deteriorated. Knee replacement was being strongly recommended. Walter was terrified of surgery at his age. He came to me looking for any alternative. We implemented every strategy I have described today. Walter changed his diet dramatically. He started aquatic exercise 3 times per week. He lost 20 pounds over 6 months. He transitioned from NSAIDs to natural anti-inflammatories gradually over 2 months. He added glucosamine, chondroitin, and collagen supplements. The first few months were difficult. His pain was not as well controlled as it had been with daily NSAIDs. He had to be patient and persistent. But by 6 months, Walter noticed genuine improvement. His pain levels were lower than they had been before the transition. His mobility was better. His knees felt more stable. It has now been 3 years since Walter made these changes. He never had the knee replacement surgery. His recent x-rays showed his joint deterioration has essentially stopped. He is active, mobile, and living life on his terms. Walter often tells me he wishes someone had given him this information 15 years ago. He believes his joints would be in much better shape if he had not spent all those years on NSAIDs. I cannot change the past for Walter or for you, but I can share this information now. What you do with it is up to you. The message I want you to take from this video is simple. The most common approach to managing arthritis pain may be making the underlying condition worse. There are alternatives that address pain while actually supporting joint health. Making the switch requires patience and commitment, but the results can be remarkable. Your joints deserve better than a treatment that provides temporary comfort while accelerating their destruction. You deserve to know the full picture so you can make informed choices about your care. If this information was valuable to you, please share it with others who are dealing with arthritis. The more people who understand these risks, the more joints can potentially be saved from unnecessary deterioration. And if you want more information about protecting your joints and your overall health as you age, subscribe to this channel. I have much more to share with you. Thank you for watching. This is Dr. James Mitchell. Take care of your joints because they have to last you a lifetime.